hello. I'm here.
All right. How you doing today?
My button didn't want to act right a few seconds ago.
Oh Lord. All right. So what's going on with you? We haven't talked to you in a minute.
I know. It's been crazy, but I'm glad to be here. How is everything going? I'm enjoying the weather. The weather changes. I'm looking forward to summer coming. I'm ready to snatch more bodies. It's been so busy because everyone is looking forward to the summer. So everybody's working on their bodies. So it's been keeping us pretty busy.
Yes, I know everybody's definitely looking forward to getting those bodies right because we want to be out on the beach. It seems like all of this COVID vaccination stuff is finally kind of settling down, and it's time to get fine and have fun.
Yes, definitely.
All right. So
So
today you talking to us about.
contraindications. So what that is anything from a medical condition or treatments that you're getting that could prevent from you getting body contouring services. Okay, and we're gonna go over. We have a few lists to go over. So these are medical, any type of medical conditions, as I said before, or treatments that will cause you not to be able to get body contouring services. So what we will start off with is the pretty much basic contradictions, which the first one, number one, is pregnancy. If you
Oh,
are pregnant, if you were recently pregnant, like probably within the past 6 months, or if you were breastfeeding, if you're currently breastfeeding, that's a no-no for for body contouring services. Um, Number two is patients with pacemakers, stents, or any implants to do with heart valves. And the reason why we say that is because there are some services that may include electromagnetic services, treatments, and may also include radio waves, things like that. We don't want anything that would affect the function of the pacemaker or stents or anything like that. So that's also a contraindication of body sculpting. Patients using skin thinning or sun sensitive medications, patients who have undergone recent surgery within the past 3 to 6 months or dependent on healing. So we have some people, everybody's body is different. So we have people who have different healing times. So that's why they give a scale of 3 to 6 months, because a lot of times it takes wounds longer to close or fully close, and you don't want any type of procedure. A lot of the stuff that we do is manual as well. So you don't want anything that could reopen those wounds or cause any type of infection or disturbance. Okay. Um, Patients with liver disease or a malfunctioning liver,
mm,
patients with cancer who are currently undergoing cancer treatments. We don't want to do anything like we have clients that probably are in remission. Some of these services we do require that they get the okay from the doctor first, because some treatments the doctor may feel like they're doing pretty well. They're a little bit further out as far as their recovery and things like that. So the doctors may say, okay, you can get X, Y, and Z, but not these items. So we always suggest that you go and you talk to your doctor and get his okay before you get anybody contouring treatments.
oh wow. I didn't know it was
Patients,
it was that deep.
huh?
I said I didn't really know it got that deep. I this is very interesting information.
Yes, because if you're in remission, any of these treatments at any point in time can take you out of remission. So we don't want anything like that. So we just want to make sure that the doctor, because the doctor knows a lot about the type of treatments that we do in detail, and he would know if some of those things will take you out of remission or cause any type of problem for any other medical condition that you may be dealing with. Okay. So patients with diabetes type 1, patients with high fever. Now, back to the diabetes, even if they have type 2 diabetes, I still always suggest that they get a notice from the doctor. Even though we are trained to say that we can treat certain conditions if they're under control, like high blood pressure, if it's well maintained. certain diabetes conditions, but we always still, once again, ask for the doctor's okay. Patients with high fever, certain medications, and we ask with the medications as well. Even if you don't have any type of current flare-ups with certain conditions, if you are on medication for any type of chronic diseases or anything like that, consult your doctor, because certain medications, we want to make sure that it's not messing with the effect of the medication. If that's going to keep you healthy, we want you to be in your healthiest state as possible, okay? Patients with vascular diseases. Once again, we're going back to those radio waves and things like that. We don't want anything that will affect the function of your heart. If you're already dealing with heart disease, or if you're dealing with any type of heart conditions, we don't want to affect anything like that. So we would just prefer, once again, to consult your doctor. Patients who have undergone a medical transplant.
Oh, wow.
Okay, that's very important. Patients with autoimmune conditions.
Wow.
Patients with medical transplant in the treatment area, and patients with thrombosis. And let's see. Now, if you're going into conditions, contradictions in the treatment area, they're only this list that I'm about to go over are only contradictions if the condition is in the treatment area. So here we go. Carriers of large metal prostheses in the treatment area. Patients with medical transplant in the treatment area. Patients with the tendency to keloid scar tissue in the treatment area. Patients with hernia in the treatment area. Patients with open wounds on or near the treatment area. Patients with infection of skin sensitivity to treatment areas. So that's only if you're getting service in certain areas. These are actually contraindications of that, okay?
Wow.
Now, if you're going into fat freezing, which is certain things like cool sculpting, I know a lot of people hear about cool sculpting. It's such a big treatment that people talk about. You see it on social media, online all the time. These are contraindications of cool sculpting and any other type of fat freezing services. Now, it doesn't eliminate the other contraindications because those still apply, but these are mainly attached to that treatment. Patients with blood clots or coagulation disorders, patients with epilepsy, patients with Raynaud disease. So those three are contraindications if you're doing any type of cool sculpting, okay?
So can I ask you a question real quick?
Yes.
Okay, so I have a friend who may be finding out that she's got some type of autoimmune something going on. So if she gets a service, what does that actually, what would happen?
Well, I mean, it could do multiple things. What we don't want, autoimmune diseases can cause a lot of other important areas of your body to break down. So what we don't want is for us to do anything that will further infect or affect the autoimmune system, which can trickle down to other parts of the body and cause other multiple problems. So that's why we said it's important that she consult with her doctor. First, she needs to get her diagnosis. So if she's not for sure that she has an autoimmune disease, then it's important that she stays in touch with her doctor and make sure that that's actually the diagnosis. Then talk to the doctor about things that she may want to do in the near future to her body, and find out if the doctor sees any type of, again, contraindication to those treatments. If so, then I would suggest that she don't get any treatments, but she could also talk to the doctor to find out what an alternative could be to that. There are some services that we can do on certain conditions that won't affect. It's just certain treatments that we do that may involve radio frequency or radio waves down, beneath the skin surface, things like that. We want to make sure that we don't do those type of treatments, but we do have other treatments that doesn't even include using a machine that can still be offered, but we still once again want that to be approved by the doctor.
Okay. All right.
Where was I? I lost my thought.
I'm sorry.
Okay. No, that's okay. It's not you. Okay, so now a lot of people have heard of a service called EMS. So that's electronic magnetic stimulation. And that's like in a lot of people get that done to like build muscle in certain parts of their body. So like your abs, your legs, your arms, your shoulders, your calves, your glutes. This machine can be used by stimulating through magnetic stimulation the muscles beneath the skin surface and basically strengthen them. So when you're doing your abs, it's equivalent to 12,000 crunches in 30 minutes.
Oh my
Same
God.
thing with the glutes. This machine actually contracts that muscle at a rapid rate, like 3-4 times the amount of crunches that you could do in the gym. These are the contraindications of that particular treatment. Patients with vascular diseases, patients with epilepsy, patients with cochlear implants or hearing aids, patients with metal implants. I'm sure you understand why I say metal implants, because this is magnetic. This treatment is magnetic. So we don't want it to cause any type of attachment to any any metal implants that you may have within your body, where it could possibly relocate those metal implants and cause problems.
Oh my
So
goodness.
that's why we say you cannot get EMS. If you hear that term EMS from a body sculpting technician and you know you have any of those things, it is advised that you do not get those treatments. Okay. Now, these actual contraindications will require a doctor's note to use if you're getting a body wrap or if any of the other conditions apply. So if you have a cataract infraction of weakness, infraction of weakness, marked high or low blood pressure, and it's not under control. Pregnancy, if you have constricted blood vessels, overactive thyroid, blood disorders, severe general infection or fever, diabetes requiring insulin, open wounds, skin diseases, severe varicose veins, implanted pacemaker, acute joint injury, first 48 hours, lupus, multiple sclerosis, and again, epilepsy, or if you have issues with dental, enclosed infection of dental or of the joint, those you will require a note from the doctor before you can get any treatments done, okay? So then we have one more list, which is called absolute contradictions. So these are no matter what, it is not suggested that you get body sculpting services. Now, with some of those conditions that I named earlier, there are exceptions to the rule, but it's all based on the doctor's approval. But these are absolute contraindications. Pregnant, breastfeeding, HIV and AIDS, cancer of all forms, undergoing chemotherapy or immune therapy, immunodeficiency, lupus, high blood pressure that's uncontrolled, diabetes that is also uncontrolled, keloid scarring. One second.
Uh-oh. I was all into it. I was
Oh,
listening.
sorry. My daughter's bus is here to pick her up.
Okay.
Excessive pigmentation, vein inflammation, any type of steroid medications, because the treatment with steroid medications, the treatments will increase inflammation. So you definitely don't want to get any type of services if you're on any type of steroid medication. And that could be also like for asthma, things like that. So once again, because we know there is some type of steroids in a lot of cases in asthma medication. So you also want to consult with your doctor. chemical peels or laser resurfacing, sunburn. So those are the things that you definitely want to make sure that you don't that those are absolute contraindications that in a lot of cases the doctor will not approve you to get body sculpting services. But like in the case of pregnancy and breastfeeding and things like that, you want to make sure or talk to your doctor and say, okay, how many months after I have my children and after I breastfeed am I able to get services done? And I'm not sure what the doctor will say, but it's a great possibility. It could be 6 months, it could be a year. But I would say consult with your doctor because, like I said, everybody's situation is different, and we don't know what everyone's situation is. And based off of medical history, it could alter the amount of time that the doctor will allow you to get body sculpting services after pregnancy and breastfeeding. Okay. As far as high blood pressure, if it's now you can get services with high blood pressure, but it has to be controlled. It has to be controlled. Diabetes as well. Now, type 1, they say that is a contraindication. But as I said before, if you consult with your doctor and it is controlled, there is a possibility that he will sign off on you getting body sculpting. Vein inflammation is the same as cardiovascular issues, which, as we said before, can cause further problems if you have heart issues. Body sculpting, depending on what services you're getting, can cause issues, especially if you're going with the EMS service. If you're doing any type of uh, uh, oh, I can't even think, Lord have mercy. If you're doing radio frequency or any type of radio waves, anything that includes radio waves or anything like that, you don't want to do anything regarding the heart. You don't want anything that will alter the heart rate, the heartbeat, the rhythm of the heartbeat, especially if you're already dealing with cardiac issues. So we don't want anything like that to be an issue in the long run, okay? So in closing with this list, what I say to you is it is very important that you consult with your doctor regardless of what the condition is. It could be something as little as a sunspot on your skin. You don't know if that could be something that could be developing skin cancer or anything like that. Always pay attention to your body and always go see the doctor. Me personally, the littlest thing that I encounter with my body or see or that I know doesn't look right, I'm running to the doctor. And I would suggest everyone do the same because we want to keep up with our health. We want to make sure that we stay healthy. We want to make sure that we stay on top of things that are changing with our body as we get older. The littlest pain, if you're lacking sleep, all those type of things could play a factor into it being some type of issue internally with your body. So always stay on top of that. Because what you don't want is you don't want to come in and get treatments and then later find out that you have cancer or later find out that you have autoimmune disease or things like that. We see a lot of autoimmune disease in people who have kidney failure, kidney disease, things like that. So pay attention to your body. Just pay attention. That's so important because with body sculpting, we do require that you drink plenty of water, but you have a lot of people who drink plenty of water that doesn't go to the washroom as often. And a lot of times that could be a malfunction of the kidney. So just pay attention to those type of things and go to the doctor, stay on top of getting checked out and know your body, learn your body. So you can enjoy the benefits of a lot of the services that are being offered out here. It also protects us as body sculpting technicians. And always be honest when you're coming in to get treatments done, because we do have people who may not want to disclose that they have a medical issue, but that could be so dangerous, and it could be a problem for you and it could be a problem for the technician. So always be honest when you're filling out your intake form. Always inform us if you have some type of issue with your body, if you're having some type of medical condition, if you're on medication, if you've had some type of cardiovascular issue, or if you have diabetes. Just let us know those things because like I said, there are other services that we can offer, but we always want to get that note in from the doctor that says that it is okay to perform those services. And like I
Wow.
said, it protects you, it protects your health, it protects you from having to be rushed to the hospital in the long run, and it protects us because all we want to do is pretty much help you get your body to your goals that you want to be, and we don't want any issues in between then. So it's always important to be honest.
That was very informative because, there are a lot of people, especially when you threw high blood pressure and diabetes and cardiovascular stuff in there, because those are like the top, and cancer, those are the top four. It's like,
Mm-hmm.
you have a lot of people that may be dealing with, high blood pressure to some degree, especially, of course, I do the 2 shows with holistic health practitioners, and, the foods that we eat um, definitely are contributing to bad health, a lot of the foods that we eat. So when you mention those 4, you kind of got everybody. Well, not me, but there are a few of us that don't have those issues. But I'll just say you got a lot of people that fall in that group. So is
Yes.
so are you running into issues? I mean, you decided to do this show, and I'm sure you were inspired by something. So are you running into issues like that?
Well, we do get people that come in and they're honestly putting on their intake forms what their medical condition is, which before we do anything on the client, we do consultation. So we go over their form after they fill it out, we look it over, and there are red flags at times to where we have to go in and tell them, I'm sorry, we can't perform this service on you today, because they already come in knowing what service they want. They book a specific service. So when we look at what they put on that intake form and we look at the service that they want, we have to go in and say, I'm sorry, you have to get a note from your doctor first. So we have had to turn people away. And a lot of times they're looking so forward to coming in and getting the treatment, but safety is more important. Safety's first with us. And like, even with the autoimmune diseases, there are over 80 autoimmune diseases out here.
Wow.
It's over 80. So it's like, it's so many people, and especially in the Black community, there's a lot of us that are dealing with a lot of these diseases out here, that are dealing with a lot of medical conditions based off of lifestyle, how we eat, not drinking enough water, not taking in enough of this or that, not taking our vitamins, or maybe taking like what I did learn a little while ago. I had a friend who ended up with kidney disease, and the reason why was because he was taking vitamins from a specific health food store that he thought it was designed just for men. He thought it was great, and just over time it caused problems for his kidney. It's like, it's so important that you look into the ingredients that are in these medications, especially when you're buying them over the counter. Look into reviews, see if anyone has complained about issues with their bodies, or something has caused a difference in their daily function due to taking this medication. So it's like, you want to make sure that you just do your research before you take in something new. We have had people come in that may have had lupus or things like that, and they really want to, because their body, otherwise it's hard for them to get in the gym. It may be hard for them to their body doesn't react like someone who doesn't have these issues may react to exercise. So they find us as an alternative. They don't want to go under the knife because of their medical condition. They may not be able to. So they see us as an alternative to come in and get treatments done, but we can't service them either.
Wow.
So it's kind of like a brick wall for them, and I feel bad for them, but it's like, it's not the end of the world, because like I said, everybody's body is different, and the doctor may approve them to get certain things. So that's why we tell them, okay, just go see your doctor first, but we can't service you today. It doesn't mean we can't service you after you see your doctor, but it's based off of what your doctor says.
So,
So
and I know it's almost time to wrap up, but I just want to ask a quick question. So we talked about physical health. Do you kind of monitor people for mental health as well, and the reasons that they are trying to make these changes to their bodies? I mean, if someone came in and, it's like, my guy is going to leave me because he wants a bigger butt and a smaller waist. Do you still it's based on what he don't want it, but he wanted on her. That's what he likes in a woman, a bigger butt and a smaller waist. So do you like kind of counsel or guide people that are doing it for someone else and not for themselves?
I mean, I kind of gauge their energy when they come in. Some people, they come in, they're not the most friendliest people, and we're always, really nice to everyone because we want everyone to feel comfortable when they're in our facility. So, you have some people who are not that friendly and you just kind of leave them be. You service them, but you let them relax in silence. You don't really pressure, conversation with them. You say a few things to just kind of gauge their energy. And once you get that, you just kind of uh go move on accordingly. And then you have some people that just are really open with what's going on in their lives. I haven't really had anyone come in and say, I'm doing this because my boyfriend wants me to do this. But you will have some women come in and say, girl, I broke up with my boyfriend and it's time for me to do something for me. I'm always doing stuff for everybody else. I'm always putting everybody's feelings above mine and I always put myself last, and it's time for me to do something for me, which I understand completely because as a woman, I get in those moods too. I feel that way too. Mm-hmm. So I get those, and then we may get someone that may say, I just don't want to go under the knife. I'm scared of surgery. My friends went through it. I've seen how their recovery was. It was very hard. I don't want to go through that. Or you have, the biggest thing is women who have young children, and they'd be like, I have young children at home. I barely have time for myself. I can't get out to exercise and work out. And I finally had an opportunity to get away, and I came here to see, what you can do to help me. So that's the main things that we get. And I more so sit back and try to listen versus give my opinion. Because that's really all they're looking for. They're looking for someone to just sit back and listen because they really don't have anyone to talk to a lot of the times, or, their life just overwhelms them and they just need someone to just listen. So that's what I do. I'm sure when I get to that point, to when I have someone in that type of predicament, I will be ready to give advice, but kind of touch it with a baby's touch because, people are so sensitive.
Mm-hmm, mm-hmm. Okay. I just want to know because, I just want to ask because I've heard the plastic surgeons that actually do the surgery because, that is a little bit more of a risk of your life while you're under anesthesia or whatever. Mm-hmm. And so they kind of gauge the mental health and see why they are taking this risk, and making sure that it's something that they want and not that they're trying to change themselves to please someone else. So I was touching on that with my opening conversation on the evolution of relationships and loving yourself first, how it makes a difference in the partners that you'll choose. So, if you have someone that doesn't really love themselves too much, they're willing to become whatever it takes to please another person. Mm-hmm. So how can people get in touch with you if they don't have all of that stuff going on and they want to come in and get a bigger booty and a smaller waist? What we do?
Of course, we're at Anatomy Body Bar, which is located at 4102 183rd Street in Country Club Hills, Illinois. We go by appointment only, and you can reach us there at 708-954-2639, or you can find us on Facebook and Instagram under Anatomy Body Bar. Body is spelled BODII.
Okay. All right. Well, thanks for another great show, Danita. That was really great information. This will definitely
hope it helped.
It'll definitely have to be a replay because I think people need to know that, okay, just because it's not surgical, that doesn't mean that you can just run off and get it. So this is definitely a great informative show. So when is your next show?
My next show it's always the second Monday of each month. So that date would actually be April the 4th, April the 11th, if I'm not mistaken. That will be my next show, April the 11th.
All right. Well, we look forward to seeing you then. Enjoy the rest of this beautiful day.
Thank you. Everyone enjoy the weather while we have it, because you know in a few hours it's gonna be cold again. So
You
let's just
said
get
a
it
few
in while we
hours.
can.
Not a few
Get your
hours.
exercise in. Yes, get your 30 minutes of exercise in today and just take in the sun. If we get any today, take in the sun. And everyone, please, please just live your life to the fullest and let's focus on better health.
Okay, I'm with you. Thanks a lot, Danita. We'll chat with you on April 11th then.
Okay, talk to you then.